Coming up on the program, a look at the healthcare of the senses, starting with the eyes, then ears, nose, and throat.
Support for What's Health Got to Do with It is provided in part by the American Brain Foundation invests in research across the spectrum of the brain, knowing all brain diseases, disorders, and injuries are connected. There can be no cures without research. Learn how you can make a difference today at americanbrainfoundation.org. Rethreaded knows human trafficking destroys lives, but they also know it's not the end of the story. Rethreaded believes in the potential and power of all survivors to reclaim their lives. Visit rethreaded.com to learn more. And Elevate Med. Through mentorship, leadership development, financial literacy, a robust peer network, and tuition-based scholarship support, Elevate Med is dedicated to the next generation of diverse physician leaders as a tangible step towards the eradication of health disparities. More at elevatemed.org.
From the moment we're born to our last breath, every American embarks on a journey through the intricate maze of the healthcare system. These are their stories, one life at a time. Let's meet Vicki. At age 52, Vicki loves photography until lately. Colors seem faded, and she struggled with glare in bright sunlight. Reading was harder, and night driving felt unsafe with oncoming headlights blinding her. She chalked it up to age and screen strain. But when she started seeing double in one eye, she booked an eye exam. The cause? A surprisingly common condition hiding in plain sight. Can you guess it? Hi, I'm Dr. Joe Servin, a practicing neurologist at Mayo Clinic and professor of healthcare administration and policy at Arizona State University. This is What's Health Got to Do with It, which looks at where and how healthcare intersects with your life, helping you get the medical answers you want. Now let's turn our attention back to Vicki. The diagnosis is cataracts. And joining us now is Dr. Rani Banik. She's a board-certified ophthalmologist and author of the book Beyond Carrots, a science-backed guide to protecting and enhancing your vision through nutrition and lifestyle. Now, as we just heard in Vicki's story, common eye conditions like cataracts can quickly and quietly impact daily life until they become impossible to ignore. So Dr. Banik is here to share what we can all do to see better for longer. And she joins us now. Dr. Banik, it is a pleasure to welcome you to our program.
Thank you so much, Dr. Servin. It's an honor to be here.
Well, I'm going to start off. I brought up a case with Vicki, and it seems to be a common question for our listeners. But can you talk us, at least at the beginning, cataracts seems to come up as a very common issue that a lot of people are familiar with. Can you just talk a little bit about how common it is for someone to have cataracts and what those signs and symptoms may be?
Absolutely. So cataracts are a natural part of aging within your eye. And I always tell my patients, if you're fortunate enough to live long enough, you will develop a cataract. Most people develop cataracts usually in their late 50s, early 60s. It doesn't necessarily mean you have to do anything about it, but it usually the physiologic change starts to happen in that time frame. That being said, people can get cataracts at earlier ages also. Even younger people, even children can sometimes be born with cataracts or develop them. So it can happen at any age.
Because this seems to occur, or at least this is one of those conditions of the eye that's affecting age or related to age, what are the biggest myths that you encounter about eye health and aging? What are the big questions you're getting that you like, I want to dispel this, that you hear a lot?
Yeah, well, one big myth is that, people do undergo certain changes in their vision as they get older, and they're frightened that those changes will continue and that they'll eventually go blind, that they'll completely lose their sight. So I want to reassure everyone that that is not the case. Yes, there may be certain things that happen as we age to our eyes, like presbyopia, which is difficulty reading up close. Most of us get affected with that, usually in our late 40s or so, or early 50s. Cataracts are another aging aspect of the eyes. Sometimes dry eye happens as people get older, but all of these conditions there are amazing treatments for. So you don't have to keep suffering with these symptoms. It's possible to get treated and have certain things sometimes even reversed based on some of the advanced technologies that we have. So there are lots of options to treat some of these age-related vision issues.
I love the title of your book, Beyond Carrots. And I love the focus on, nutrition, if you will, to help with good visual health. I'm wondering if you could share with us what are some surprising foods that are really great for our eyes and our vision overall.
Absolutely. Many people, when they think about nutrition and food, they immediately jump to carrots. So that's why I named
Yes.
the book Beyond Carrots, because there's so much more we could include in our diet to help protect our eyes. So, there are many foods beyond carrots, like leafy greens are a wonderful addition to your diet, especially because they contain two eye health nutrients called lutein and
Mm,
zeaxanthin, really important for our eyes to protect against macular degeneration. But if you're asking, what are some surprising foods?
yeah.
I would say a couple of things.
Okay.
Number one, colorful bell peppers. So many people turn to the
Really?
green, variety of bell peppers, but actually orange and yellow bell peppers are way more packed with eye healthy nutrients than the green ones. So choose the yellow and orange ones. Also, egg yolk. The beautiful orange yellow color of egg yolk is because of these nutrients, lutein and zeaxanthin. So have some egg yolks in your diet. And also there are some spices like paprika and cayenne pepper and even turmeric. So all of these can be healthy additions to your diet to help support your eyes.
God, I'm getting hungry just thinking of all of this, and I know that it's good for me if I go for those foods. Uh, One of the big questions that a lot of folks often ask us, and I'll ask you, is that you talked about aging and vision, and I'm wondering is how much of vision loss is preventable, if you will. Is that our destiny? If you're old, if you as you age, it's just the vision's going to get worse, or are there steps that you can do to prevent that?
Yeah, so I'll share some interesting statistics with you, Dr. Servin. So the WHO, or World Health Organization, estimates that there are over 2 billion people in the world with some kind of vision impairment. And of those 2 billion people, over 1 billion cases of vision issues could have been prevented,
Wow.
which is crazy to think that 50% of the vision issues that many people experience can be prevented with the proper interventions. I'm a big fan of nutrition, but also lifestyle, supplementation, and healthy habits like I have a morning routine that I recommend for my patients, how to keep their eyes healthy, green smoothies, seeing your eye doctor on a regular basis. All of these things can help protect your vision. And this is why I put together the Eye Health Summit, which is an online conference happening in May, from May 1st to May 7th. It's completely free to join, but I brought together 35 experts to help share all of these amazing insights and strategies about how people can protect and preserve their vision for a lifetime.
Oh, I love that. So let me ask you this: if let's say that you're on the younger side, let's I'm going to go with 40s and or even 30s. Are there things that people should start doing at those ages that just helps to make sure that your vision is well preserved for later?
Our modern day life really takes a toll on our eyes. We're on screens for hours and hours and hours a day. Even kids are on screens for like at least 6 hours a day. Adults, maybe 7 to 10 hours a day. So we need to be proactive about our eye health. And, if I had to say what my top 3 tips would be,
Right.
it would be to number one, eat lots of those eye healthy nutrients because they will help you protect against cataracts and macular degeneration and dry eye and glaucoma. Second would be when you're on screens, take frequent breaks. So don't be on screens, glued to the screen for hours and hours. We typically recommend a simple thing called the 20-20-20 rule, which basically means every 20 minutes, take a 20-second break and don't look at your screen. Look at something far in the distance, about 20 feet away.
Okay.
So again, 20 minutes, take a 20-second break, look at something 20 feet away. That'll help relax your eye muscles. And then the last thing I would say is exercising. We know that exercise is good for many other aspects of health, our heart health, our brain health, et cetera. But it's also important for our eye health because that helps. It helps to prevent some systemic diseases that can affect the eyes, like high blood pressure, diabetes, helps to keep some of those aspects of health in control. And also, regular exercise has been linked to decreased glaucoma progression and decreased macular degeneration rate. So all in all, it's a good thing to include in your daily habits.
I love that advice. One of the questions we also get has to do with special glasses for that eye strain. And I know you just gave us a great tip in terms of helping that, but we often hear a lot about blue light glasses. And I'm wondering if you can address, is that a helpful thing or is that a hyped thing when it comes to digital eye strain? If you could comment on that, that would be great.
This is actually one of my favorite topics because I love to bust this myth. Many people think that they need to get blue blocking glasses, and there is actually no scientific evidence that shows that blue blocking glasses actually work. So, to answer your question, Dr. Servin, it is kind of a fad. It's kind of a trend, but there's really no science behind it. They've done studies, and most blue blockers, which are lightly tinted, either clear or light yellow or light gray, really don't do much. But if you really want to protect your eyes, and we talk about this a lot during the Eye Health Summit, I have multiple speakers talking about this topic of blue light, is to eat the right nutrients. And I mentioned those nutrients. I'm going to say them again: lutein and zeaxanthin. They're kind of hard to remember, hard to pronounce, but these nutrients act like our natural blue blockers and our natural sunglasses. They get deposited in the back of the eye, in the macula, and they help protect against those harmful wavelengths of light. So instead of the blue blocking glasses, eat your leafy greens, eat your yellow peppers, eat your egg yolk, and you'll do even better at protect. And that's actually been proven. It's been scientifically proven, as well as taking supplements with these nutrients. That's also been scientifically proven, rather than those blue blocking glasses.
And it'll probably save you some money too, I suspect, if you don't go for those glasses.
Yes.
To all of our listeners out there, you're listening to What's Health Got to Do with It on WJCT News 89.9. I'm Dr. Joe Servin, and if you're just joining us, we're in conversation with Dr. Ronnie Bannock. And we're talking eye health, and we want to hear from you. Tag us on social media at jservin. Dr. Bannock, I know you've just talked about exercise and good nutrition. So my question here is, can our eyes offer a window into other larger body issue diseases like diabetes or high blood pressure? Can you talk a little bit about that?
Yes. And, many people have heard the phrase, the eye is a window to your soul.
Yes.
In reality, the eye is a window to our health. And I'll share something really interesting with you. We talked about I mentioned a few conditions earlier: high blood pressure, diabetes. We can detect the earliest changes of these systemic conditions in the retina, in the back of the eye. Mm-hmm. So sometimes I can't tell you countless numbers of patients I've diagnosed with diabetes simply by doing an eye exam. And patients may not know that they have these conditions. I've diagnosed strokes, multiple sclerosis, autoimmune conditions like rheumatoid arthritis or other types of autoimmune conditions like lupus through an eye exam. So again, the eye is truly, I hate to say this, but it's almost like the canary in a coal mine.
Got it.
If something's happening in somewhere else, another body system or organ system, then it will show up in the eyes first. The eyes are very susceptible to damage, and oftentimes we are the first providers to pick it up on the exam and then refer patients out to other providers to get those conditions treated and managed. So it really is important. I mentioned this again, getting regular eye exams. Everyone above the age of 40 should get an annual dilated eye exam.
Okay.
Just like we all go to the dentist twice a year, go to see our primary to get our labs done once a year, get our mammograms, colonoscopies, your eye exam should be a regular part of your annual health maintenance.
I love it. I know you have brought up supplements a couple of times, so I'm going to ask real specifically about visual supplements. If you go down the vitamin aisle of any grocery store or pharmacy, there are a lot of eye health supplements. And I'm wondering, will nutrition do the trick if you have those egg yolks or those beautiful peppers or spices? Or do you need to have visual supplements on a daily basis? Talk us through that decision.
That is a great question. And unfortunately, most eye care providers probably don't even know the answer because we're not really taught nutrition science during our training. But I've really done a deep dive when I was preparing to write my book. I did a deep dive into the research. And what I'll share with you are, I'm just going to give those two nutrients as examples, lutein and zeaxanthin.
Mm-hmm.
We need about, in terms of lutein, we need about 6.5 to 10 milligrams of lutein a day. Most of us, especially people on a Western diet, get less than 1 to 2 milligrams a day. So there's a huge gap between what our eyes need and what we're getting from diet. Now, if you're eating 5 cups of leafy veggies a day and, maybe another 1 or 2 cups of fruits and other produce, then yes, you're probably getting your complete eye nutrition. But if you're not eating that volume, you're probably not getting enough. And it may seem like a lot, 5 cups, but it is doable and it's not actually that difficult. I share some simple strategies in the summit and as well as in my book. But if you're eating enough, great, you don't need to take an eye health supplement. But if you're not eating enough of those nutrients, I strongly suggest people take an eye health supplement because we're on screen so much. We really get bombarded by blue light. These nutrients protect against blue light. They help protect against so many eye conditions. It's worthwhile. And look at the label. Look for lutein and zeaxanthin in the label. That's really important.
One of the questions that often comes up in any condition or health care related situation on this show is that there seems to always be gender differences in how either a problem is diagnosed or managed. And I'm wondering, are there gender differences in how vision symptoms or issues show up or get diagnosed? Do we know?
We do know, and yes, there are differences. Unfortunately, women tend to be much more affected by eye conditions than men. And I'll share a couple of examples with you. Dry eye, which is common across the population, is particularly more common in women, particularly in women who are either perimenopausal or menopausal or postmenopausal. And it has to do with hormones. So all of these hormonal changes can lead to dry eye. And, if I see an elderly woman, let's say above the age of 70 in my office and she doesn't have dry eye, that's the exception. The far more common situation is that elderly women come in and they have dry eye. So common. Other conditions as well. We know that glaucoma and macular degeneration and autoimmune conditions are much more common in women. So especially this is a shout out to all of you women out there. If you're over for age 40 and you have not gotten your eye exam yet, please make that appointment today to go get your annual checkup. And again, we talk about all of these issues and concerns on the Eye Health Summit. Some of the experts that I've interviewed really share such deep insights on how people can manage conditions like dry eye and blue light and even kids' eye health. There's a lot we have to be concerned about now with kids being on screens. And there's an increased risk of myopia, which is nearsightedness. Mm-hmm. And there are ways to combat myopia. So, again, you can get all of this information for free by joining the Eye Health Summit. I really, really hope people take advantage of this opportunity to join and listen.
I want to give you some questions from our listeners, and I'm going to start off with the first one is from a listener named Gretchen, and I think this harkens back to our case that we talked about with Vicky and cataracts, and it's a simple question: is cataract surgery low risk? So I guess that's a simple way of asking. Can you talk a little bit about how you manage cataracts and when you need to have surgery and what happens in that circumstance?
Sure. So I'll preface this by saying that cataract surgery is the most commonly performed elective procedure in the world.
Really?
Yes, millions of people have cataracts, and probably hundreds of thousands of people get cataract surgery every year. And in the vast majority of cases, those surgeries are highly, highly successful. Now, that being said, it's a surgery, yes. So there are risks. There are certain risks, but the risks are very minimal with our modern technologies, with our instrumentation, and also with the medications that are used in the postoperative period. What we worry about the most is infection.
Okay.
We don't want there to be an infection after cataract surgery. And patients do use eye drops, antibiotic eye drops, for about 2 weeks to 1 month after surgery to prevent that risk of infection. But again, the vast majority of patients have highly successful outcomes. And as long as the rest of your eye is healthy, you can expect to regain much of the vision you lost as the years have gone by. So if you used to be 20/20 when you were younger, and now you're not, maybe you're 20/40, 20/50, and you've been told you have a cataract. If you have that cataract surgery, there's a high likelihood that your vision will return back to 20/20. So I do recommend it. On a personal note, both of my parents had cataract surgery. Both of them did very well. They're in their mid-70s. They're so happy that they had it done because it restores function. It allows people to read again and drive again and use their devices and see faces. So it's, when it's ready, it's not ready, immediately for everyone, but when the cataract is ready, I do encourage people to consider getting cataract surgery.
I have another question. This one is from Marianne, and she wrote, if you work in a dark environment like a TV studio that is very low lit and you are in it for hours at a time, does it harm your eyes? So that's a good question. It could apply to other professions, I suspect, as well. But what would you say to that situation, Dr. Bannock?
Yeah, so I want to kind of take people back to maybe when they were younger and their parents said, don't read in the dark,
Right.
It'll ruin your eyes.
Yes.
I believe the question is similar in that vein. This is another myth. A lot of people believe that if they're reading in the dark or they're doing tasks in dim lighting, that their vision will get worse. It won't get worse. You may have more strain. It may be more difficult to read, but in the long run, it will not get worse. So just to reassure you that is a myth about reading in dim lighting. Again, you kind of have to gauge things for yourself. If you're feeling a lot of eye fatigue, eye strain, take a break, maybe turn on a little bit more light. But again, don't be concerned that it's going to lead to permanent vision loss or blindness. That won't happen.
One additional question. What about contact lenses? How long can you wear them in a given day before you have to take them out for safety purposes?
Yeah. So, even though some contact lens manufacturers will say on their packaging, they're 2-week wear, or some are even longer, 1-month wear, I strongly do not recommend that. And many of my colleagues in the eye health space also don't recommend prolonged wear. I recommend taking them out every night, letting your eyes rest a little bit, letting your eyes get lubricated naturally by tears, and also cleaning the contacts in a solution to get rid of any protein deposits or debris on the lens. So yes, even though it may say extended wear contacts, I still recommend taking them out at night. You want to give your eyes a little break from that.
Dr. Bannock, if we have time for at least one more question, and I want to ask this. If someone wants to future-proof their vision, what's the single most important thing they should start doing now or today?
It goes back to nutrition. If you want to protect and preserve your vision for a lifetime, start with the basics, with just ocular nutrition. Then fill in the gaps with a supplement. So again, number 1, nutrition, and then number 2, take an eye health supplement. Those are my recommendations.
Dr. Bannock, I want to thank you so much for giving us your time today. I've learned a lot. I think our listeners have as well. I really appreciate your work, and I'll give you one more opportunity to mention that summit.
Absolutely. Well, thank you, first of all, for having me on. It's been a pleasure. So please join us for the Eye Health Summit. You can go to our website, which is also theeyehealthsummit.com. And it's taking place in May 1st through May 7th. We have over 35 speakers talking about 35 plus topics. There's something for everyone, from younger people to older people. You can learn a lot. Even I learned a lot. So please, please, please join us and share it with your friends and family.
We've been talking to Dr. Ronnie Bannock. She is a noted ophthalmologist and author of the book Beyond Carrots. Up next, after your weekly health headlines, we focus on the healthcare of the other senses with HCA ears, nose, and throat specialist Dr. Russell Smith. And we'll be right back. Hey, it's Dr. Joe Servin. I have a new show called This Week in Health, and it's part of WJCT News Now. Local news you can listen to anytime, anywhere. When you sign up, you'll unlock 4 local podcasts delivered straight to your podcast app. I break down the week's biggest health headlines and what they mean for you. Start a free 30-day trial at wjct.org/newsnow. And if you like it, become a monthly donor to support WJCT Public Media.
Hi, I'm Stacey Bennett, producer of What's Health Got to Do With It, and these are your weekly health headlines. The measles outbreak has reached another grim milestone this year, surpassing 1,000 reported cases. 30 states in the U.S. have confirmed cases, and according to the CDC data, 13% of patients have been hospitalized, most under age 19. An epidemiology expert says the outbreak may be slowing down in West Texas as the number of reported cases per week are starting to decline. Former President Joe Biden has been diagnosed with an aggressive form of prostate cancer that has spread to his bones. While the disease is considered serious and incurable, it is hormone sensitive and potentially manageable with treatment. Doctors found a small nodule in his prostate after he sought treatment for urinary symptoms. The news comes as Biden, now 82, faces renewed scrutiny over his health and legacy following his quiet exit from public life over possible mental decline. President Donald Trump has nominated Dr. Casey Means, a Stanford-educated wellness advocate, as the next U.S. Surgeon General. Trained as an ear, nose, and throat physician, Dr. Means left her surgical residency after 4 years to focus on functional medicine, emphasizing lifestyle and root cause approaches to disease. Her nomination has prompted debate over whether the nation's top medical posts should be held by someone no longer practicing clinically. And should you ask a doctor before you consume cinnamon? After your body fully absorbs the spice, the main active ingredient is converted into another compound that may interfere with prescription medications. Researchers say this could lead to unexpected herb-drug interactions, especially if you're taking medications for high blood pressure, diabetes, cancer, arthritis, or depression, or if you're on blood thinners or other liver-processed drugs. Even mixing it with other supplements like turmeric or ginseng could pose a risk. And now for some good news. What do sweetie, honey, and are we ready for our bath have in common? Well, they're all examples of elder speak, baby talk used with older adults that can feel patronizing or even trigger resistance to care. Researchers say that changing the way we talk could reduce conflict, medication use, and improve dignity in healthcare. And those are your weekly health headlines.
Welcome back to What's Health Got to Do with It. I'm Dr. Joe Servin, and from the windows to the world to the gateways of sound and smell, our next stop on our sensory health tour moves from the eyes to ears, nose, and throat as we explore how to protect the senses that help us connect, communicate, and breathe easy. Let's meet Bruce. Bruce is a 60-year-old retired teacher who thought his hoarse voice was just left over from a cold. But weeks passed and it never fully returned. He noticed mild pain when swallowing and a small lump on his neck. Friends said he sounded different, raspy, almost strained. He finally saw his doctor, who referred him to a specialist, and what started as a sore throat turned out to be something far more serious. What's the likely diagnosis? The answer is laryngeal cancer. And joining us now is Dr. Russell Smith. He is a head and neck surgeon and ENT specialist who has recently returned back to Jacksonville, and he practices in affiliation with HCA Memorial. He treats patients with conditions ranging from sinus issues to throat cancers like the one we just heard in Bruce's story. And today he's here to share what we all need to know about protecting the vital senses we often take for granted. He joins us now in studio. Dr. Smith, welcome to our program.
Thank you, Joe. Appreciate being here.
We love having you here. Let's get right into this. You just heard Bruce's case, and one of the reasons we talk about cases is because people identify with that part of the story. How common is Bruce's presentation, a hoarse voice? And I guess the follow-up to that would be, when should someone be worried about a change in your voice?
It's interesting that all of us throughout each year of our life have hoarseness, soreness in our throat, stuffy nose, just feel poorly, and we attribute to a cold, or we have a little reflux or allergies. Most of those things, though, especially if we think about colds, they should be gone within a few weeks.
Okay.
And so your symptoms, if they're there and then they get better within a few weeks, that's pretty reassuring that it's not something to worry about. But especially for something like hoarseness, if it lasts for more than 3 weeks, typically the recommendation is that somebody needs to take a look at your throat, look at your voice box to see if the vocal cords are normal, make sure there's no masses there that could be causing that symptom, because in reality, it shouldn't stay around for more than a few weeks.
How common are these type of cancers overall? Do we know?
So head and neck cancer in general, believe it or not, is considered rare.
Okay.
And so as we think about lung cancer, breast cancer, there's probably 250,000 cases of those types of cancers each year.
Okay.
If we put all the different sites of head and neck cancer together, there's probably 50 or 60,000. So if we think about larynx cancer in and of itself, probably 8,000 or 9,000 cases per year. And comparing that to 250,000, you can see where it's considered a rare cancer.
Understood. For those who actually develop it and they may have it, or there's a concern, or there's a family history, what are some of those early warning signs of head and neck cancers that you just should not overlook?
So, as we said, if the things persist, that's a big issue. If you're coughing up blood, that's really a big warning sign. And having things kind of coupled together. So if you have a little bit of hoarseness, but you have this intense pain in your ear, that really shouldn't go together. Hoarseness shouldn't be linked to ear pain. And so when you start to see some of those symptoms coupled together, and the reality is anytime you develop a lump in your neck, that's a big warning sign. Because even when most of us get colds, we may feel a little swollen, but we don't typically have a lump in your neck that you can physically feel. And that really starts to bother us, that could be cancer spread from a site in the mouth or throat into a lymph node.
Does the lump in the neck, is it something that has to stay, or is it something that just comes and goes?
So if it comes and stays, for sure to be worried. If you have a lump in your neck and you have some of these other symptoms that aren't explainable, you really have to be concerned about that. And so, our general rule is, especially in someone who's over the age of 20, if you get a lump in your neck, it's cancer until proven otherwise. And so we really make people aware that neck masses should be something that's very concerning and needs to be evaluated.
We have talked a lot on this show about the human papillomavirus. There's a vaccine. And I'm wondering if you can talk about how HPV has changed, if you will, the landscape of throat cancer, particularly in younger, non-smoking people.
So way back when I was a trainee, decades ago,
We won't ask.
most of the patients who we saw with throat cancer had a heavy use of alcohol and tobacco.
Okay.
They were in their 60s. They presented with severe pain in their throat, difficulty to eat, weight loss. And as I kind of went through my training, even in that 5 to 7 year period, all of a sudden we started seeing younger patients. They'd have a lump in their neck. They didn't have many throat symptoms. And it's kind of in that area of the 1990s into 2000 that we really start to see HPV-related oropharyngeal cancers become something that's prominent. And over the last decades, it's become the largest increasing incidence cancer of the head and neck area.
Wow.
And so it's really the dominant cancer that we see now. And it's one that is important to diagnose as being HPV-related because our approach to it is much different because we understand that patients that have that cancer, they overall do better with therapy.
I see.
And so we have to find that right balance of detecting it appropriately, offering the correct therapies, and trying to make that right balance of treatment side effects and long-term cure from the cancer.
Is there a way to figure out whether a specific head and neck cancer is HPV related other than just the story?
So there's specific tissue testing that we can do.
Okay.
There are little surface proteins that we can actually do little stains to see if they're present within the cancer cells. We can also check the cancer itself to see if the HPV DNA is within the cancer cells. And then the thing that's probably coming to the forefront most recently is that we can actually check your blood and we can look to see if there's circulating tumor DNA related to HPV within the bloodstream. And so it's not diagnostic, but we know that patients who have HPV-related cancers will have elevated circulating tumor DNA. And so that's something that's really coming to the forefront and will be a big factor in us thinking about diagnosis, treatment, assessment for recurrence as we move forward.
Let's say someone is out there, they have a lump in their neck or like Bruce's story, persistent hoarse voice or sore throat. They call, make an appointment to see someone like you. Walk us through what happens next. What occurs in that scenario?
Yeah, so if a patient comes to our clinic for an assessment for a neck mass, a good exam is the starting point. And so you want to examine not only the mass itself, but you want to get a good look at the entirety of the mouth and throat. Sometimes that's just by direct visualization, but the thing about the head and neck area is we've got lots of hidden places that's hard to get to. And so it's not uncommon for people to have a small flexible scope put through the nose, down the throat, to be able to look at all the surfaces of the lining of our throat to see if there's any irregularities. And then that kind of starts that process from an exam perspective. Most people will also get a CT scan of their neck to better define the mass, its characteristics, are there other things going on? And so that's really the starting point for an evaluation.
You already brought up the story of alcohol. I mentioned smoking. Are those the main lifestyle habits that increase or decrease the risk, if you avoid them, the risk of developing these cancers? If someone wants to prevent this stuff,
right?
Talk about the lifestyle part of it.
So there's really no amount of smoke exposure that's been defined as being good.
Okay.
And so we know that as you smoke and the more you smoke, you start to increase your risk of cancers. Alcohol has a little bit less consistent data, but if you heavily drink, we know that increases your risk. And it's amazing if, let's say that, smoking increases your risk 5 or 6 times, alcohol increases your risk 2 or 3 times. If you put them in combination, it may increase your risk 30 times. And so it's really that combination of those carcinogen exposures that can really increase your risk of head and neck cancer. Obviously, the HPV exposure will increase our risk. And then there are probably some environmental exposures that we don't clearly define for sinus cancers. Radiation exposures can increase your risk of having cancers within your salivary glands or your thyroid gland. And obviously sun exposure for skin. So all those things are very important things. And we have the ability to, in reality, control the vast majority of those.
Speaking of the HPV vaccine, that's something that one should get.
Yes. The key is to get it young, though, because
Okay.
all of us have probably been exposed to some HPV in our life. And the reality is it one of the high-risk types or is it a low-risk type? How does our immune system deal with it? Some people have an exposure and their immune system completely rids it from the body and there's not a problem. But some people, that virus will stick around, and if it turns out to be a high-risk virus, it can turn a normal cell into a cancer cell.
And to all of our listeners out there, you're listening to What's Health Got to Do with It on WJCT News 89.9. I'm Dr. Joe Servin, and if you're just joining us, we are talking about the health care of your ears, nose, and throat. We want to hear from you. Tag us on social media at jservin. There is a well-known, it's either the CDC or other public health commercial with a non-smoking commercial. And the individual speaks through one of those almost voice box, for lack of a better word. And that always has painted a picture of what people envision surgery for, the laryngeal area voice box to look like. So my question to you is, how has surgical treatment changed or not changed from what it's been and when that famous commercial came out?
The reality of the surgery for head and neck cancer, it can be devastating. And we sometimes do have to remove parts of people's jawbone, and we have to remove their voice box. And if you think about how important our facial structure and all our anatomy is for how we eat, communicate, engage the world, so having those things done is radical. If we can catch cancers earlier, sometimes we don't even have to do surgery. We can do non-surgical approaches with chemo and radiation therapy to try to treat cancers. Similarly, we've made a lot of advances. If we catch the cancers at the right time, we can do less invasive surgeries that actually people tolerate very well. And so not all cancer surgery that's done for head and neck tumors is that radical, disfiguring, life-altering. But it relies upon catching things early, being able to implement less invasive approaches.
So how do you help patients preserve voice and swallowing ability to those that have to undergo a procedure? How is that decision made?
So each patient will present with certain complaints. We'll do what's called a cancer staging evaluation and determine the extent of their tumor. A lot of times we have to determine their actual level of function before we start treatment. Some people really can't breathe or swallow or talk because their cancers are so advanced when we see them. We use a very team-oriented approach, and so all of our patients will actually see a speech and language pathologist with me the first visit. And so we actually start even like prehabilitation before people start any cancer therapy, because the more we can do to preserve speech and swallowing throughout cancer therapy, whether that's surgery or radiation, the better those patients will do long term.
I know you have returned back to Jacksonville, and I'm wondering, as someone who's in the ENT community, can you talk a little bit about what do you hope to bring to the Jacksonville, Duval County area ENT care? Talk to us a little bit about that.
I'm a big proponent of being very comprehensive with cancer care. At times it can become very focused of like, what are we going to specifically do to treat that cancer? But we really have to kind of treat that whole person and treat the family. And so it's really important to be able to surround yourself with a team of people to help take care of cancer patients. And as I mentioned, we have our speech and language pathologist. We also have nutrition. We include mental health. We include navigation. We have a whole host of kind of multi-specialty interactions. And I really want people to feel like they have a large team, an army taking care of them. And I'm a big proponent of it. It takes a lot of effort to put that team together, but I'm very proud of being involved with trying to create that environment for patients to receive their cancer care.
We ask this question to all specialists and physicians and folks that grace this show, is that we always know everyone always hears myths about their particular area of expertise, and we give an opportunity for them to debunk a myth. So I'm curious, what myth that do you often hear about ENT cancer that you'd love to debunk right here and now?
I think we touched on it a little bit earlier, is that all cancer surgery for head and neck is radical and it's debilitating. We actually have ways that we can use surgical therapy to treat patients, and actually at the end of the day, they may have the least side effects from their cancer therapy if we can employ minimally invasive surgical approaches. I think the biggest evolution we have is now for some of these HPV-related throat cancers. We can actually do transoral robotic surgery where we can use the mouth as a natural opening into our body, and we can put the robot through the mouth and reach down around the back of the throat. We can see around the corner, and we can very precisely remove these cancers and really minimize some of the more radical effects that we have to do with other surgical approaches.
Let me ask a little bit about this, because robotic surgery has a certain sound. It almost sounds like you press a button and then you walk away. Tell us, what does it actually look like when you say there's robotic surgery going on? Because I don't think we often get to have folks who explain that to us.
Yeah. So the surgical robots are a system that's set up where the robot that's beside the patient typically has 2 or 3, maybe even 4 working arms. One of those will be a very sophisticated camera system that actually has 2 different binoculars. And so as we think about doing video things, it's usually 2-dimensional. When we do robotic surgery, the visual field is actually 3-dimensional. And then we can use little small arms, put them through either incisions that are made in the abdominal wall or the chest wall, or in the case of the head and neck, we put them through the mouth. And then once those arms are in position, I would be sitting at a console with little hand controllers, almost like playing a video game. And so I'm able to move my fingers and my wrist, and that makes the arms that are in the robotic arms that are inside the patient do certain motions. And so it allows us to kind of get inside to work without large incisions, and it really decreases the morbidity of the surgery.
So that was going to be my next big question. Does robotic surgery give you, is that the main advantage, that it gives you a tighter control, or?
So it gives us great visualization because we're operating at multiple levels of magnification versus the naked eye.
I see.
It also minimizes the devastation of the approach. So if you can think about any place we operate, if we have to make a large incision through the abdominal wall, which is, 1.5 feet long, versus we make 4 half-inch puncture wounds and we work through those 4 puncture wounds. For the head and neck area, what we sometimes have to do to get to these same areas is we'd have to make an incision that would split the lip. We would have to actually cut the jawbone in half. We'd have to open things up. And all the damage that we do to normal tissues just to get to the cancer, we can eliminate that with robotic surgery in certain cases, and that really decreases the recovery and the side effects that go along with that approach.
One of the things that I often get questions, particularly in the world of ENT, is that you're in the area of face, and I mean, like, just by definition. So when it comes to how an ENT physician, and this is just to help listeners who are not familiar, does that, similar to plastic surgery, tell us a little bit about the credentials and the things that get you to be an ENT cancer doctor, for that matter?
Sure. So obviously everyone has their medical training, and then you do what's called your residency program. And then once we get into specialized cancer care, people typically do what's called a fellowship.
Okay.
And those fellowships really focus on cancer. And it makes a difference of how you approach the world, because as you do your cancer part of your training, you have to start thinking about all the specialties. I'm a surgeon, but I think about radiation. I think about chemotherapy, and I have to feel like I understand how those parts work. And I think doing that extra training gives you that more holistic approach to making sure patients know all their options for their cancer therapy. Because lots of patients do have options of how surgery or non-surgical ways can be used, and it's important to be able to share that with them.
Does that mean, does an ENT doctor also do the reconstruction or plastic surgery portion?
We do.
For this part as
Right.
well?
And that can be done in a host of different ways. For most of the otolaryngology programs now, as you do a head and neck fellowship, that includes both the cancer component as well as the reconstructive component. And some of it's just doing more local flaps, but other becomes very sophisticated because we can take part of your leg and rebuild your jawbone. We can take part of your arm and rebuild your tongue or your throat. And by doing so, we can really maintain good function for people who do need to have more advanced surgeries.
Dr. Smith, I want to, in our final moment, I want to give you this opportunity to address this question. If there's one thing you want our listeners to this episode and other episodes to take away from our conversation when it comes to your work or ear, nose, and throat health in general, what message or what words of wisdom do you wish to impart, if you will?
One thing I see is people have fear of what it may mean when they have one of these symptoms, and that avoids them to go to the doctor to be seen. And I think realizing that addressing it earlier is better than addressing it later, because the reality is that this problem is just going to get worse. It's not going to get better on its own. And so Bill willing to say, hey, I got a symptom. This doesn't seem right. Let me go get checked out. And I think that's one really key theme. I think, the other thing that I want to emphasize is the importance of vaccinations.
Okay.
As it really relates to the HPV vaccination, we're making progress, but we're still, a long ways from where we need to be to try to eliminate some of these HPV-related cancers, which with good vaccination, we could be able to essentially eliminate some of these cancers. And so I think understanding it's a safe vaccination and it's important for your health is a really key message I'd like to share.
Dr. Smith, if folks want to find you specifically, what avenues or what website number, how can they find you in the community?
So Russell Smith, put it in there and I'll show up on the webpage.
I can't ask for an easier way to do that. I want to thank you so much for, number one, for the work you do and for giving us your time today. I know you're super busy. This has been terrific.
Thank you so much. It's been really, really enjoyable to share information.
We've been talking to Dr. Russell Smith. He's a practicing otolaryngologist or ear, nose, and throat specialist. He specializes in cancer care. He works in affiliation with HCA Memorial. Well, that's our program for today. We hope you've enjoyed our show. If you missed anything, you can listen to the full episode at wjct.org and on your favorite podcast app. Thanks to all of our guests. Our executive producer is David Luckett. Stacey Bennett is our producer. Brady Coram is our director. Caden Collins and Caroline Kahn are our researchers. If you have questions about this or any topic, let us know by calling us at 904-358-6362. Email us at health@wjct.org or tag us on social media at jservin. I'm Dr. Joe Servin, and you're listening to What's Health Got to Do With It on WJCT News 89.9 Jacksonville. Thank you for listening, and stay in touch.
Support for What's Health Got to Do With It is provided in part by the American Brain Foundation invests in research across the spectrum of the brain, knowing all brain diseases, disorders, and injuries are connected. There can be no cures without research. Learn how you can make a difference today at AmericanBrainFoundation.org.
Rethreaded needs you to make a difference in the lives of human trafficking survivors. Learn more about supportive services and an array of survivor-made products at rethreaded.com.
And by Neurelis, a leading neuroscience company focused on the development and commercialization of therapeutics for the treatment of epilepsy and other neurologic disorders. The company's unique drug portfolios strive to address unmet needs in patient care. Learn more at Neurelis.com.